Hey everyone, welcome back to the We Care podcast. I'm Jordan Vaughn, nurse practitioner.
And I'm Molly Cooey, RN with We Care. And today we are diving into lab work.
That's a fun one. Let's talk about one of the most frustrating things patients hear. Your labs are normal. Because if you're listening to this, you still feel exhausted, foggy, gaining weight, anxious, or just not like yourself, that answer is not helpful.
And honestly, this is usually when people give up or think, maybe this is just how I'm supposed to feel. And that isn't the case. So today we're going to explain why normal does not always mean optimal, what labs actually miss, and how we approach testing differently at We Care. So let's clear this up first. Normal just means that you are inside a lab reference range.
Exactly. And those ranges, they're built to catch a disease process, not early dysfunction or hormonal shifts, nutrient depletion, or chronic inflammation. So you can be normal and still feel awful, which we've all experienced. And this can especially be true for, women, busy professionals, nurses, parents, athletes, just a lot of people who are under chronic stress.
Most people get a very basic panel, CBC, CMP, maybe TSH, and that's it. And those labs don't always answer why you're tired. Why can't you lose weight? Why is your mood off?
And that's why we go deeper, because symptoms usually live in the gray area and not in the extremes.
So let's walk through an example of what a comprehensive We Care panel looks like, because patients always ask what makes ours different.
So I love that idea, first off, but let's talk about those basic things first, because we do check those as well. So some people come in and they're like, well, are you going to check my liver and kidney function? Yes. We're going to check a CBC. That is your blood counts. It looks for anemia. It's looking for infection, immune patterns. We're also going to check a CMP. That is the liver function. That's your kidney function. It's your electrolytes. We're going to check an A1C, the 3-month glucose, and we're also checking a fasting glucose. One of the other basic panels that we check sometimes if you're fasting is a lipid panel, and that's checking like cholesterol and also the risk patterns.
Right. So these tell us if something major is off, but they're only the starting point. Tell us about all the levels we check when evaluating thyroid health, because as we've said before, especially in our thyroid episode, TSH alone does not show the whole picture.
Amen. So the TSH, it's basically how your brain is signaling your thyroid to work, and that is the main, test that most providers are looking at. If it's high, your brain is, pushing harder because the thyroid is not keeping up, and if it's low, basically the brain is easing off. We also check a free T4. So this is the main hormone that the thyroid itself makes. And I like to think of it more of like a raw material. It shows how much hormone your thyroid is actually producing. And then we check a free T3, and this is probably, one of my favorite ones. It's like the active hormone that your body is actually using for energy and metabolism and brain function. So I feel like if this one's off, that's when I really see, my patients struggling. And they can have a, normal T4 and still feel awful, and it's usually related to the conversion in that T3 level. We also check a TPO antibody, which is like your immune system attacking your thyroid. And I feel like this is missed by probably 80% of providers. They don't check a TPO antibody, and they'll have patients on like levothyroxine. They'll have them on medication for hypothyroidism, and the patient never knew they had Hashimoto's, and they come here and their TPO antibodies are insane. So it's crazy.
And that just shows someone can have a normal TSH but still have poor conversion, autoimmune activity, cellular hypothyroid symptoms, which is why it's so important to have the entire picture.
Yes. Another lab level that we like to check or a couple of lab levels that we like to check is the DHEA and cortisol. I don't check cortisol as much because I don't feel like you get the proper levels when you're doing a blood sample. There's better ways to check cortisol, but it is something that we can do, and that is your body's main stress hormone. A lot of people have, cortisol lower levels and higher levels, and just dysfunction in their cortisol. We're also checking that DHEA, which is basically plays a role in your energy and mood, immune function, and it serves as like the building blocks of the sex hormones like estrogen and testosterone.
Right. So when the DHEA and cortisol are off, you don't feel just a little stressed. You feel like your whole nervous system is out of sync. So let's talk about the sex hormones that we check next.
So I'll break these down into like women and men, but we're not looking at just one value. You never want to look at your hormones in isolation. With women, we're looking at the FSH. So that is the follicular stimulating hormone. It's what helps, regulate the reproductive function. In women, it gives us clues about, ovarian function, menopause, cycle changes. So if they're premenopause, perimenopause, or full-blown menopause. We also check estradiol, and that's the main estrogen hormone. It affects your energy, mood, brain function, bone health, and how a female body would store fat. Too much or too little, it leads to weight changes. And most of the time, the women come in, they're like, I have this inner tube right here, and I just can't get rid of it. I usually know that their estrogen's off when they say that, or if they're having mood swings and brain fog. Progesterone is another hormone that we check. This is kind of like the calming or balancing hormone. A lot of people miss this one, and I find that a lot of patients, especially like PCOS, and they have a irregular progesterone level. We're also checking testosterone in females, which is taboo to some people. They're like, oh, females don't have testosterone, only males do. But we want to check a total and a free testosterone. You can have a normal total, and your free can be very low, and you will feel terrible when it's like that. So the free is like what's circulating, in your blood. It is what your body can actually use, and then total is all testosterone within your body. We also check a sex hormone binding globulin. I like to think of it more like a car. It's picking up those hormones and driving it to the cells where they're needed within the body. If it's too low or high, hormones, may look fine on paper, but they're really not fine because they're not getting to where they need to go. And for men, we're pretty much checking the same thing, total testosterone. We're looking for, much higher levels in males than females. Free testosterone, I find that is where a lot of the men are struggling. They may have a normal total testosterone and their free is in the dumps, and their provider has missed that portion of it. We're also checking the sex hormone binding globulin, estradiol levels. Men need estrogen too, just not in the same ranges that females need.
Right.
And we're also checking a PSA, which is their prostate antigen, and just looking if that's elevated, that's a cancer risk is why we check that.
Right. And the symptoms don't come from just one hormone being bad. They come from hormones being out of balance with each other. And this is important because two people can have the exact same total testosterone number and feel completely different. This is why we do not treat only the numbers. We take into consideration the symptoms that a patient is experiencing as well.
Yes, hormones do not operate in isolation. Balance matters more than a single number for sure.
Chronic inflammation is another one of the biggest reasons people feel bad, even when labs look fine.
And that's why we check a CRP. That's a marker of inflammation. It tells us if your immune system is activated or if you're just like under chronic stress. Mildly elevated CRP can explain fatigue, joint pain, brain fog, why weight loss feels harder than it should.
We also, have vitamin deficiencies that don't always show up as extremes in labs, but they absolutely show up as symptoms. Can you tell us a little bit about the micronutrients that we can check?
Yes. Vitamin D is one of the big ones. I feel like it acts more like a hormone, but it plays a huge role in immune health, mood, inflammation, bone strength. That's a big one. Low levels are common, and they are the biggest thing you hear is, I am exhausted. And someone can have a completely normal hormone panel, a completely normal, CMP, every CBC, and then they'll have a vitamin D in the dumps. You get that up and they feel like $1,000,000. So B12 is also another vitamin level that we check. It's essential for energy and brain function, nerve health. Low B12 can also cause that fatigue, and it works with metabolism as well. So we see that, with patients trying to lose weight, they increase their B12, they see better metabolism. And then we can also check magnesium, and that helps support like relaxation. I know a lot of people have heard more recently about, taking magnesium, and that's going to help sleep. But we can also check it on your labs, and that if we can get that, up and regulated, it helps with anxiety and sleep and muscle cramps and headaches.
That's awesome. There's also some more in-depth labs that we can perform, but of course it's not just for everyone, but when we do need them, they can be game changers.
Absolutely. The ones that we've already talked about, those are on everyone's panel. That is our We Care panel. That is what we're checking every single patient that walks through the door for. Some of the additional ones that we can do are iron studies. We can do a growth hormone study, homocysteine, autoimmune markers, gut testing, genetic risk markers. There's so many more that we can add on.
So if you've ever been told everything is normal, but something is off, you're not imagining it. Your body is communicating. Labs are just one part of learning how to listen.
And we're not looking just whether something is flagged. We're looking at the patterns here at We Care. And we're trying to match the symptoms and your lifestyle and your sleep patterns. We're looking at all of that and trying to match it if we can find, what's causing that in the lab. And that's, the difference between treating numbers and patients.
So if this episode resonated, share it with someone who's been told they're fine but doesn't feel fine.
And if you want a deeper or more personalized approach to your health, you know where to find us.
So make sure to subscribe, share this episode, and follow We Care Health and Wellness for more education and behind-the-scenes content. And don't forget that at the end of the day,
we care.